head-to-toe assessment. I'm a student nurse at Vernon College. I have gathered all of my supplies, and I've already done the vision and the Weber's and Ron's test, as well as the reflexes, and they were all +2 bilaterally. I will start off by giving him privacy, closing the door or the curtain, performing hand hygiene, and obviously asking for his permission. Is it okay if I do a head-to-toe assessment on you?
Yes, ma'am.
Okay, can you tell me your name and date of birth?
My name is Anthony Owen Garrett, and I was born in 1/3/11.
Okay, do you know what today is?
Saturday.
Do you know who the president is?
Joe Biden.
And do you know where you're at?
United Regional.
Okay, so patient is alert and oriented, ×4 to person, place, time, and day. He is dressed appropriately for the weather in the head-to-toe assessment. I will start off by assessing his skin on his arms. Skin is warm, dry, color is appropriate for ethnicity. Skin turgor is quickly and recoils. Nails are well shaped, there is no trauma to them. I will check the capillary refill on each finger, and it's all less than 2 for both hands. I will assess the radial pulse bilaterally. They're both +2 and even at the same time. Now I will start with the head. It is normal cephalic. It does not look like it's out of shape or anything. I will palpate it. There's no lesions, bumps. It's clean of any debris. Does any of this hurt?
No.
No pain? Okay. Now I'm going to go to his ears. Can I get you to stand up for me? And then turn around like that. Okay, I'm gonna get you to cover up one of your ears for me and repeat what I say.
Apple.
Okay, cover up the other ear.
Banana.
Okay, you can sit down for me. I'm going to use my pen light. I lost my pen light last semester at the hospital, so we're gonna pretend it's a pen light. But with the pen light, we're going to look at the ears. There's no lesions, no bumps, no trauma to the ears, no drainage. And then we'll look at both of them as well. There's no, it's normal color for his ethnicity. Since he was able to cover his ears and repeat what I said, his cranial nerve number 8 is intact. Okay, so now we're gonna go to his face. Can I get you to raise your eyebrows for me? Squint your, close your eyes tight. Smile for me. Blow out your cheeks. Okay, and cranial nerve number 7 is intact. Now we're going to do something. Can I get you to close your eyes for me? And I'm gonna put this on your face. Let me know if it's dull or sharp.
Dull. 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 Oh.
Okay, alrighty. And then can you clench your teeth for me? Okay, does that hurt?
No.
Okay, and I will also palpate his tragus. And none of that hurts. So cranial nerve number 5 is intact as well. Now I'm going to go to the eyes. His eyes are symmetric. They're even. There's no swelling on the eyes or anything. I'm going to palpate his sinuses. Does any of this hurt?
No. Okay,
I'm going to press on the lacrimal apparatus. Does that hurt?
No.
No swelling or pain. I'm going to pull down his eyelid. Look up for me. There's no yellow. The sclera is white. There's no drainage, no lesions, any bumps or anything like that. Now I'm going to get you to, or with the pen light, we're going to look at the constriction with direct light and indirect. So we'll do direct, and then we're going to do indirect while I shine my light on one eye and look at the other one. Okay, and then both pupils constricted at the appropriate time. Now I'm going to get you to look behind me, and when I say look at my pen, you can look at it. So look at my hand. Okay, now look at my pen. Okay, accommodation is there. Now you're going to follow my pen, and don't move your head, just your eyes. Okay, the pupils were equal, reactive, round to light. And now we're going to go to your nose. His nose is symmetric to his face. It's not uneven or anything like that. I'm going to look in his nose with my pen light. There's no polyps. No lesions, no drainage. Can I get you to hold one of your nostrils? Blow out. Now the other one. Okay, there's our patent. Can I get you to close your eyes for me? Okay, and I'm going to ask you what you smell.
Coffee.
Okay, so cranial nerve number 1 is intact. Okay, you can open your eyes. Now I'm going to go to his mouth. Can I get you to, or his lips are pink and moist. There's no lesions. Can I get you to open your mouth? See, all his teeth are there. There's no cavities, no signs of trauma, no missing teeth. Let me see. We're gonna look at his gums. They're pink and moist. Look at the hard and soft palate. His buccal mucosa. It's all pink and moist. No lesions or bumps. Open your mouth really big. Stick out your tongue for me. Say ah.
Ah.
The uvula, it rose appropriately, and he has tonsils. No swelling of the tonsils or no lesions or bumps. Can I get you to swallow for me? Okay, his trachea is midline. Stick out your tongue for me. Push it, stick it out. Now put it left or right. There you go, okay. And then now I'm going to get you to push up on my arms. Okay, so cranial nerve 11 and 12 and 10 are intact. Now I'm going to go to his thoracic. Can I get you to stand up for me? And then I'm going to check for even expansion. So can I get you to take a deep breath and let it out? Okay, so the back rose evenly bilaterally. Now I'm going to check for firmitis. So whenever I say, I put my hands on you, say 99 for me.
99. 99. 99.
Okay, vibrations were felt evenly and bilaterally. Now I'm going to percuss. Okay, Renaissance was heard. Now I'm going to listen to him to both sides bilateral. Okay, take a deep breath for me. Let it out. Again. Okay, again. 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 And one more time. Okay. His lungs were clear and all filled. Now I'm going to move to the front side of his body. There's no labored breathing, no difficulty breathing. I'm going to check for expansion again. Go ahead, take a deep breath. Let it out. Okay. Now I'm going to check his lung sounds on his anterior side. So once again, take a deep breath. One more time. One more time. Again. One more time. And one more time. Okay. Now I'm going to, you can sit down. I'm going to assess his, okay, now I'm going to check his carotid pulse one at a time on each side. Okay. And it's even, not bilateral, but it's even and it's bounding, it's appropriate. Now I'm going to check for JVD with my pen light. Can I get you, I would get him to lay down at a 45-degree angle, the head of the bed. And then I will get him to look down and to his left, so look down. And put your head to the left, that way. Okay, and no signs of JVD or swelling. Now I'm gonna get you to lay on the couch for me. And you can put your head going that way. Okay, now we're gonna assess his abdomen. The contour is even, it's round, it's not, it doesn't look, there's no bruising or anything like that. There's no peristaltic waves. We're going to now listen to his bowel sounds. Well, before we do that, we're going to listen to his heart sounds. We're going to use the diaphragm and the bell side of the stethoscope on each side. So we would start with the aortic, the pulmonic, the herbs, the tricuspid, and the mitral. And the mitral is also the apical, so we would listen for 60 seconds on the apical pulse. And okay, with his abdomen, we've inspected it already. Now we're going to auscultate it starting from the left lower and going up to the right. We're gonna start at the right lower, going right upper, then left upper and left lower. Then I'm also going to listen to for any aortic right over his liver. Okay. Now I'm going to percuss over his liver, and it sounds dual like it should sound. We're going to palpate or percuss over in the same direction. Right lower, right upper, and left lower. Okay. With the bowel sounds, they were active. If you were to not hear any bowel sounds, you would have to listen for at least 5 minutes. Now we're going to palpate in the same order with the right lower going up. So right lower, let me know if any of this hurts. Then right upper, left lower. Did any of that hurt?
Only the left upper.
Okay, and then now we're going to go down to his femoral pulses, which they are right here. And you would palpate them bilaterally, make sure they are even. We're going to his legs. His legs are warm. They're pink color for his ethnicity. There's no lesions, no bruising, no bumps or anything like that. Then we would go ahead and put your feet up, like that, yeah. His popliteal, we would also palpate them at the same time. They're +2 bilaterally. For his toes, we would check for capillary refill on all toes. They're less than 2 seconds. We'll assess his pedal pulses at the same time, which they are both bilateral +2. Okay, push up against my hands and then push down. Okay, so his lower strengths are bilateral and even. Can I get you to squeeze my fingers? Okay, his strength on his hands are also bilateral and even. Okay, go ahead and put your legs down. With one of your legs, go to your knee and go down. Okay, now your other one, same thing. Okay, now can I get you to stand up for me? Okay, put your arms out and close your eyes. All right, so Romberg test is negative, and that is it.